In another development, in order to eradicate corruption in the water and health sector, socio-economic right and accountability project Serap has set up a program aimed at promoting accountability and addressing corruption in the water and health sector in Nigeria. The Director General of Bureau of Public Service Reform (BPSR), or Dr. Dasuku Arabis, said citizens should hold government and government should be responsible to its citizens. It said that 54% of people don't pay water levy fees and 93% of people pay with cash, pointing out that there are manipulations by the people that cannot be controlled by the government alone. An assistant research consultant, Bose Popola, said that according to the recent Serap research, 2,919,354 people have been denied medical service between 2020 and 2021. According to her, out of 2,919,354 people, 1,518,068 are being denied medically service due to inability to pay medical fees. Over 1 million are being denied medical service due to lack of bed space. She had also mentioned that 70% of people don't have access to water.
Observe in your report a situation where 54% of respondents depicts people who connect to public water source illegally without payment, and 93% represented people who pay direct cash for connection to water source is indicative of the rot and leakages prevalent in the system. This cannot be handled alone by government, but calls for citizens' attitudinal change and orientation.
How corruption in health, education, and water sector is plugging Nigeria into further poverty. The work of Serap is very important, considering the fact that government's primary assignment and responsibility is to assist and protect all citizens in an equal manner.
To know the opinion of people when it comes to how are they getting or have accessibility to water and to health facilities in Nigeria. So we try to make a methodology which is going to be in the form of household sampling, and we're able to talk to them to ask them how did they get their water source, which I said a lot of them, 79% of them were not able to get water supply from government facilities, which means they provide their own water sources by themselves.
These issues are not new, really. I don't think they are new to any keen watcher of follow-up events in the country, even to the public institutions themselves. It is to ensure that we apply the much-needed pressure as citizens to ensure that they comply with the provisions of the law in favor of the people.